So you may remember me. I'm Dr. Sergio Piñoviedo, past president of the History of Pathology Society. And last year, we started with our first mid-fall online meeting where we did a specific talk about the asking tumor. And this year, Dr. Santi, current president, was really interested in continuing this mid-fall online meeting, which hopefully continues through the years with this fantastic topic of bone marrow pathology. And then she had a great idea to also include in this meeting our Azar Award winner for the year, in order for those who haven't had a chance to see this person present at USCAP to also have heard, which one was the winner abstract and what was talking in that abstract. So just very briefly, for those who you don't know, so as Dr. Santi mentioned, Henry Azar was founder of the History of Pathology Society along with Christian Neselov. He had a bachelor's in arts from Aleppo, Syria, where he was originally from. Then he was in the American University of Beirut. Then he came to the United States and worked in the New York hospital in the 1950s. Then he belonged as part of the army in the United States in mid-1950s. Had professorships in Columbia, Kansas, and South Florida. Then he was chief of laboratory medicine at Java, and then in Tampa, he has remained from 1972 up to 1992. And later on in his career, he actually did a PhD in medical history, not far from where I'm right now in Durham, North Carolina. He was at the University of Chapel Hill, UNC in 1998. So the Azar Award, as you know, it's given to the abstract that is recognized for some scientific discovery related to history of pathology, epidemiological study, or any sort of history of pathology related abstract that is related to this part. And last year, our Azar winner was Dr. Natalya Ramirez. Dr. Ramirez is a third-year pathology resident at the Duke University, and she is a current chief resident at this institution. And her presentation will be related to infectious disease, and the title is the Deja Vu, reflecting on the 1919 pandemic and comparing measures taken then to developments used during the COVID-19 pandemic. So with that, and for no further ado, Natalia, if you're ready, we leave you the platform.
Yeah, thank you, Dr. Pina. Give me 1 second to share my screen. Let's see. Okay, so as Dr. Pina said, my name is Natalya Ramirez. I'm originally from San Antonio, Texas, and pursued my undergraduate degree in molecular biology at the University of Texas at Dallas, and then ended up graduating from medical school at the University of Texas Medical Branch in Galveston, Texas in 2022, and now I am a PGY3 resident in anatomic and clinical pathology at Duke University Hospital. And briefly touching on my personal interest in history in general and the history of pathology, my grandfather, who was born in a small town called Oilton, Texas, he was born in 1926, and as such had lived through a lot of history. He served in the Army during World War II, and following that became a history teacher and later principal in the San Antonio area. And even after retiring, was very excited to share his love of history with me and my family and talk about different historical eras that he actually lived through himself. And that did rub off on me. And so I do have just like a kind of personal interest in history now that I'm in the medical field and pathology. I've found it very interesting just learning about different aspects of the history within medicine and history and developments in pathology. So, like Dr. Pina said, my presentation, my abstract was titled Deja Vu, Reflecting on the 1918 Pandemic and Comparing Measures Taken Then to Developments Used During the COVID-19 Pandemic. So why I chose this topic, it was very topical. I think it's still very relevant today. The COVID-19 pandemic was widespread and is the most recent one of note. Sorry, I just have to minimize my screens here. There we go. It's the most recent pandemic of note and has had many impacts on daily life and society that even in 2024, we are still feeling remnants of today. And so this really took hold, I think, of the world back when I was a rising third-year medical student. And so as a student in training in medical school, at peak social distancing, I got to see many real-time changes in how medicine in general and how graduate medical education was being practiced and how things were changing fairly rapidly. So I also got to live through, witness the rapid development in testing for COVID as well as the vaccinations against COVID, and got to see the evolution in the public health practices that we were all implementing, as well as the public response to those practices. So going back in time to 1918, the H1N1 pandemic, which was coined the Spanish flu or Spanish influenza, was very quickly widespread due to soldiers that were traveling across the globe during World War I, and about somewhere between 50 to 100 million deaths worldwide were attributed to the H1N1 pandemic. And just to compare, this is in comparison to 20 million deaths that are attributed to specifically World War I alone, which both were happening at the same time. And most deaths were actually due to a secondary bacterial pneumonia after acquiring the H1N1 virus. And more than 500 million infections were documented worldwide. During this time, treatment was majorly limited to only supportive care with a focus on prevention. So different interventions that we saw in 1918, specifically public safety interventions, included case tracing, quarantining, wearing facial masks, and limiting social gatherings in public spaces, a lot of which we actually implemented during COVID back in the start, especially in 2020. And back in 1918, when all of these new cases of the disease were being noted, new laboratory techniques and the development was emerged at the time. It wasn't clear that this pandemic was due specifically to a virus. In fact, most people considered that Haemophilus influenza was the causal agent of influenza, although a group at the Pasteur Institute in October of 1918 did hypothesize that the pathogen responsible for this pandemic could possibly be a virus. That was not generally what people thought at the time. Interestingly, the idea of an influenza vaccine and development of that was very popular at the time, but there was really limited evidence of success, and different groups in different cities were all trying to develop a vaccine of their own, and there wasn't as much communication or sharing of information between these groups that were trying to develop a vaccine. So the composition of the vaccines varied between the cities, but they all also specifically targeted bacteria that were isolated from patients that they knew were infected with the influenza disease. And like I mentioned, these vaccines had a limited amount of success and were more and actually did not have any documented effect on morbidity or mortality of any patients with the H1N1 virus who also received any of these vaccines. And in fact, were just kind of used as a show of hopefully like of doing something and that hopefully things were going to be coming up on the other end and that we were moving in a direction to combat the virus. But again, they're really not effective and were just used to kind of calm the masses of people down that something was being done. So it wasn't until actually 1930, so several years after the spread of the H1N1 virus, that the pandemic was actually attributed to a virus. So, like I said, in October of 1918, one group at the Pasteur Institute hypothesized or theorized that it could potentially be due to a virus, but virology and just the idea of viruses in general at that time was still in its infancy. And so nothing really happened with that idea at the time. It wasn't until 1933 that the first human influenza virus was isolated specifically for influenza A. And by 1936, actually, two different vaccines were available against influenza A. And by the World War II era, so later in the 40s, a broader annual vaccine campaign was established, allowing for more widespread distribution of the vaccines. And this really helped reshape the priority of biomedical approaches in epidemic and pandemic planning over traditional public health measures that they were emphasizing during the 1918 pandemic. And so, kind of bringing that back towards what we all experienced during COVID-19 and comparing that to the 1918 pandemic, in comparison, virology is a lot more developed today than it was in the early stages of the 20th century. And we were able to quickly identify the cause of the COVID-19 pandemic. And in comparison, especially to the H1N1 pandemic, which took several years, and the need for a vaccine against COVID-19 was understood very quickly and was also a lot more quickly attainable, again, compared to the 1918 pandemic. But like I mentioned, modes of prevention in public health, preventative measures are still greatly important today, in addition to intervention. Although it's interesting to note that there were differences in the social, ethical, and political implications in how the public responded to certain public health preventative measures back in 2020 or like modern era versus back in 1918. But all that to say, the what we can do to prepare for any future pandemics is constantly in the flux and growing, of which we have data from previous pandemics to kind of lay the foundation for steps moving forward in those future pandemics. And with that, that is my presentation. Thank you, everyone.
Thank you, Natalia.
Thank you, Natalia, for your beautiful presentation again. So, are there any questions or comments for Dr. Ramirez? If not, I thank you very much for joining us today. Looking forward to see you in person in the companion meeting of the History of Pathology Society in Boston. And last but not least, new members are most welcome. And please follow the society on the official website and on social channels. And thank you again. Bye.
Bye. Thank you.
Thank you. Thank you to the speakers, of course. Thank you.